a silent threat emerges, understanding Marburg virus disease. Marburg virus disease is a severe and often fatal illness. This hemorrhagic fever can cause widespread bleeding and organ failure. The virus, first identified in 1967, gets its name from the German city of Marburg. It was here that laboratory workers exposed to infected monkeys from Uganda became the first victims of this deadly disease. The virus, a close relative of the equally notorious Ebola virus, belongs to the Filoviridae family. These viruses are known for their ability to cause severe hemorrhagic fever, posing a significant threat to public health. The initial outbreak in Marburg, Germany, served as a stark reminder of the dangers posed by emerging infectious diseases. Simultaneous outbreaks in Frankfurt, Germany, and Belgrade, Serbia, further highlighted the ease with which this virus could spread. The source of the outbreaks was traced back to African green monkeys, imported from Uganda for research purposes. These incidents underscored the importance of laboratory biosafety and the potential risks associated with handling infected animals. The Marburg virus, like other filoviruses, is known for its high fatality rate. In past outbreaks, the case fatality rates have varied significantly, ranging from 24% to 88%. This wide range depends on several factors, including the specific strain of the virus, the quality of healthcare available, and the overall health of the infected individuals. The unpredictable nature of the virus, coupled with its potential to cause severe illness, makes it a public health concern of international importance. Despite the significant threat it poses, Marburg virus disease remains relatively rare. Outbreaks, though devastating, have been sporadic and geographically limited. However, the potential for the virus to emerge in new regions and cause widespread outbreaks remains a constant concern. This underscores the need for ongoing surveillance, rapid response mechanisms, and research to develop effective vaccines and treatments. From bats to humans, unraveling the transmission of Marburg virus. Marburg virus, a zoonotic virus, finds its natural reservoir in fruit bats. Specifically, the Egyptian fruit bat, Rosetus aegyptiacus, is considered the primary host. These bats, widely distributed across Africa, harbor the virus without showing any signs of illness. The virus replicates within the bats and is shed in their saliva, urine, and feces. Transmission to humans typically occurs through contact with infected bats or their bodily fluids. This can happen in various ways, such as through bites, scratches, or exposure to bat droppings in caves or mines where these bats roost. Additionally, handling or consuming infected bats as bushmeat poses a significant risk of infection. It is crucial to note that bats play a vital role in the ecosystem and should not be demonized. Safe and responsible interactions with wildlife are paramount to preventing spillover events. Human-to-human transmission of Marburg virus occurs through direct contact with the bodily fluids of infected individuals. This includes blood, saliva, vomit, urine, and feces. The virus can also spread through contact with contaminated surfaces or materials such as bedding, clothing, or medical equipment. Healthcare workers are particularly vulnerable to infection if they do not adhere to strict infection control measures while caring for Marburg patients. The highly contagious nature of Marburg virus within healthcare settings emphasizes the need for stringent infection prevention and control protocols. These include the use of personal protective equipment, or PPE, hand hygiene, safe injection practices, and proper waste management. Early identification and isolation of suspected cases are crucial to prevent further spread within healthcare facilities in the community. Understanding the transmission dynamics of Marburg virus is essential for implementing effective control measures. Public health education plays a vital role in raising awareness about the virus, its transmission routes, and preventive measures. By understanding the risks and taking appropriate precautions, individuals can protect themselves and their communities from this deadly disease. The unfolding crisis. Recognizing the symptoms of Marburg virus disease. Marburg virus disease typically presents with a sudden onset of flu-like symptoms. The incubation period, the time between exposure to the virus and the appearance of symptoms, can range from 2 to 21 days. During this period, individuals may be contagious without showing any signs of illness. Initial symptoms often include high fever, chills, severe headache, muscle aches, and fatigue. These non-specific symptoms can mimic other common illnesses, making early diagnosis challenging. As the disease progresses, more severe and specific symptoms begin to emerge, marking a critical turning point in the course of the infection. Gastrointestinal symptoms, including nausea, vomiting, abdominal pain, and diarrhea, are common. These symptoms can contribute to dehydration, which further complicates the clinical picture. As the virus replicates and spreads, it begins to affect multiple organ systems, leading to a cascade of life-threatening complications. Hemorrhagic manifestations, a hallmark of Marburg virus disease, often appear between the 5th and 7th day of illness. These can range from mild bleeding from the gums or nose to severe internal bleeding. Petechiae, small red or purple spots caused by bleeding under the skin, and ecchymoses, larger bruises, are also frequently observed. Time is of the essence. Incubation and diagnosis of Marburg virus disease. The incubation period for Marburg virus disease, the time between exposure and symptom onset, typically ranges from 2 to 21 days. This relatively long incubation period poses challenges for early detection and containment. Individuals infected with the virus may unknowingly transmit it to others during this asymptomatic phase. Diagnosis of Marburg virus disease is based on a combination of clinical symptoms, epidemiological history, and laboratory testing. The presence of fever, hemorrhagic manifestations, and a history of potential exposure to the virus raises suspicion of Marburg infection. However, these clinical features alone are not sufficient for a definitive diagnosis. Laboratory testing is crucial for confirming the presence of Marburg virus. The most commonly used diagnostic method is reverse transcription polymerase chain reaction, or RT-PCR. This highly sensitive and specific test detects the virus's genetic material, RNA, in blood samples. Early diagnosis is essential for improving patient outcomes and implementing effective infection control measures. Prompt isolation of suspected cases and contact tracing are crucial to prevent further spread of the virus. Despite the availability of diagnostic tests, access to these tests in resource-limited settings where Marburg outbreaks typically occur can be a significant challenge. A race against time managing Marburg virus disease with supportive care. Currently, there are no specific antiviral treatments approved for Marburg virus disease. Treatment primarily focuses on providing supportive care to manage symptoms and prevent complications. This includes maintaining fluid and electrolyte balance, providing oxygen therapy, managing blood pressure, and treating any secondary infections. Intensive care, often involving hospitalization in isolation wards, is crucial for managing severe cases. Patients may require mechanical ventilation, dialysis, or blood transfusions depending on the severity of their illness. The goal of supportive care is to optimize the patient's chances of survival by supporting their vital organ functions while their immune system fights the virus. Early recognition and prompt initiation of supportive care are essential for improving patient outcomes. However, the availability of adequate healthcare resources in areas where Marburg outbreaks occur is often limited. This highlights the need for strengthening healthcare infrastructure and capacity in these regions to effectively respond to outbreaks. Research and development efforts are ongoing to identify and develop effective antiviral drugs and vaccines for Marburg virus disease. Several promising candidates are currently under investigation, but none have yet been approved for human use. The development of effective therapeutics is crucial for reducing the high mortality rate associated with this devastating disease.